This is kind of a controversial subject, but I'm not saying that every single person that goes and drinks or every single person that smokes pot is going to become a drug addict, because that's not true. That's not how it happens. However, every single drug addict that I've ever met did not start with heroin. They started with marijuana or alcohol. And over time, that wasn't enough, and so they moved on to prescription drugs like Xanax or Oxycontin or Percocet or Vicodin. And then that wasn't enough, or that wasn't as cool. And so they moved on to something that was stronger and better and cheaper. And that's stuff like heroin or fentanyl. And so you can see that natural progression. Nobody wants or grows up saying, I'm going to become a heroin addict. It never starts that way. It always starts with the benign stuff that people think are just cool party drugs that everybody does. Not everyone that tries those things are going to become addicts, but everyone that becomes an addict has tried those things. Does that make sense? So be aware, those gateway drugs start here. They start in middle school. I think it's super great that people talk to high school students, but a lot of times it's too late. This stuff starts right here with you guys. The third thing I want to talk about as far as risk factors that put you super at risk for becoming an addict is not necessarily a choice. It's when you get hurt or injured or you have to have a surgery and you get put on pain medication. So inevitably, this is probably going to happen to some of you guys, where you're going to break your leg on the football field, or you have to have your appendix taken out or something, and you're in the hospital and the doctor puts you on pain medicine, right? It's going to be a super painful procedure. You need something to block the pain, and you would be in agony. Right? This happens to people all across the world, multiple times a day, every day. And not all those people become addicts. But those pain medicines are in the same class of medicines chemically as heroin and fentanyl. It's the same type of medicine. It's just safer, theoretically. So what happens is these people take these pain medicines, and then if their injury takes a really long time to heal, they begin to be dependent on it, and their body gets hooked on it. And if they stop taking it, you have that withdrawal that we talked about. And your body starts going into withdrawal, you start feeling like you have the flu, and then you have to take more pain pills in order to not feel that way. And so you can see how someone can get hooked. Then their doctor cuts them off from these pain pills, and they have to move on to something that's on the street, which would be heroin. And that's how a lot of heroin addicts start. It's just a benign injury that they happen to have on the football field or on the tennis court, and it steamrolls into this big drug addiction. And so I think it's super important that you guys realize that avenue, because I think the majority of kids are getting plugged in that way now. It's not necessarily the choice of picking it up at a party. It's more so it's happening in a doctor's office, where you trust your doctor and your provider to say, hey, this is a prescribed medicine you're giving me, it has to be safe. But it's not always. You have to take it as prescribed, you have to take it in limitations. You can get hooked on that stuff super easy, and that's how a lot of addicts get started. And so I think it's super important to kind of be aware of that as well. And so in closing, this is what I kind of want to leave you with. Educate yourselves. Know what you're getting into. Know what you're messing with. Know what decisions that you make and how they're going to affect you. These decisions that you guys make now, every day on the weekends or at home, when you're outside of school, this stuff matters. This stuff, the decisions you make right now, are going to affect the rest of your life, the trajectory of the rest of your life. The people that you surround yourself with, the people that you decide to be friends with, that stuff is going to affect you for the rest of your life. And it can either set you up to be super successful and sober and awesome, or it can set you up for a lifetime of pain and struggle and addiction. And so I don't mean to scare you guys or lecture you or tell you what to do, but I want you guys to know the facts, to know what you're getting into, and be able to be educated to go out and make good decisions, right? So that's all I've got. I hope this has been helpful. I wish you guys nothing but the best. Ms. Batten has my information. If anybody wants to talk more, if you feel like somebody in your family needs help, or if you need help, or if you have questions, just contact Mrs. Batten. She can hook you up, and I'm more than happy to talk to you guys. Thank you. we have like about 8 minutes. If anybody has questions, I'd be more than happy to answer some questions if somebody has any. Yeah. So, yeah, the question was, can like drinking water and doing things that your body likes and things that help your body be healthy, can that take away or remove addiction? So, good question. Once addiction develops in somebody and somebody becomes an addict and their brain becomes changed fundamentally, it's super hard to reverse that. If somebody remains sober for, it's roughly about 5 years, but it takes about 5 years for your brain to fully change and recover and go back to normal. And that doesn't always happen. Sometimes brains are forever changed and they don't go back to normal. And so, yes, you can nourish yourself and eat well and drink water and all those things, but that's not always enough. You have to maintain sobriety and stay clean from stuff in order for your brain to heal and change and go back to normal. Any other questions? Yeah, good question. The question was, how did I not get hooked on drugs when everybody around me did? It's a great question. People ask me this all the time. And I don't know that I have a great answer. Genetics play a large role in addiction. If you have people in your family that seem like everyone in your family gets addicted, you most likely have genes in your brain that make you more susceptible to become an addict. When you take a drug, it affects you way differently than it would somebody else that doesn't have genes that predispose them to becoming an addict. And so, I think it's pretty likely, given my family history, that I probably have those susceptibility genes. However, and I'm not gonna lie, when I was in high school, I experimented with stuff. I smoked pot, and I drank alcohol, and experimented with all that kind of stuff. And I never got to the point where I wanted more or was hooked on it. And I don't know why that is. Everything that you go through as a child, different hardships and different experiences through school give you different coping mechanisms, and depending on how well you learn those coping mechanisms, how well you kind of handle distress and handle hard things in your life, can either set you up to deal with those things well as they happen to you, or they can set you up to want to turn to drugs and use that to cope. And that has something to do with it, but a lot of it's just luck. Yeah, it's a good question. The question was, out of all the people, when we're talking about the people that would rather pick a pinch of dopamine versus a handful of dopamine, how many of those people actually go on to stay sober and live their dreams and become happy and healthy people that beat addiction? Not very many. Once people start using drugs, it's really, really hard to stop. And I don't know the exact number as far as the percent of people that become addicts that actually make it through to recovery, but I know it's less than 25%. It's less than 1 out of every 4 people maintain sobriety for the rest of their life and live happy, healthy lives. So that's not very promising. It's a super small percent. And there's lots of reasons for that. One is that it affects your brain, and so in order to maintain sobriety after your brain is already kind of damaged and at a deficit, it's really hard to have the capability to maintain that. Once you are an addict, usually the people that are surrounding you and the people that are in your life are sometimes not the greatest. A lot of times people's friends are also addicts and also struggling, so in order to maintain sobriety, sometimes people need to pick themselves up and completely surround themselves with different people, which is really hard and sometimes not possible. So there's lots of reasons for it, but it's not very likely. Who's next? Do I have any kids? No, I do not have any kids. I'm kidless. I just have nephews and nieces. Yeah. So he asked, why would somebody take drugs to help them cope with hard things? So it's a great question. One of the reasons is it numbs your emotions. And so it numbs you so that you don't have to feel whatever you're feeling. So it's like when after Zach passed away, Daniel started doing drugs more frequently because that was hurting him emotionally, the death of his brother. And in order to kind of avoid those emotional feelings or that emotional hurt, he would take drugs because then he wouldn't have to feel that. And so that's one of the reasons why. That's probably the biggest. One more. Great question. Can you die from drug withdrawal? So, there are two types of drugs that the withdrawal can kill you. One is from alcohol. If you become dependent on alcohol to the point where you're drinking every day and you just cut cold turkey,